I think we have 5 minutes left, and I think I'm supposed to close it at this point. I'd like to thank people for really, I thought, excellent participation. It was just one big brain candy feast. I completely enjoyed the conversation. I feel like I learned a lot. And also, I think we had excellent interactions, not just among ourselves, but with the colleagues who were typing away and sending us questions. I do want to reflect just sort of philosophically about what NIOSH asked us to do, and they gave us some specific objectives, as you know. But I think the big picture is, while I think NIOSH is looking at sort of a new frontier in a way, it's not completely new. It is something that they have been thinking about for quite a long time. A number of us have been on some of these other committees, National Academy committees, to think about some of this and to give input in the past. I think the good news is what I think we heard is we have the apparatus to do this. We know how we would do it. When I say we, I don't just mean NIOSH, but we in the occupational health community who are interested in thinking about this with you, drafting it with you, and with the wider group of colleagues who are also invested in this important topic. So I think I always feel better when there's kind of a plan, and I think you even suggested or asked the committee about whether the existing way you do conformity assessment in occupational settings, would that work? And obviously there's going to be a bigger discussion about that in a longer exercise that the National Academies are going to convene for you. But it sounds like you should be cautiously optimistic about that. And you also got, I think, some terrific common sense suggestions about specific things you could do, including stuff with no money, so that you could actually start to advance toward enlarging the mission for populations that weren't historically your responsibility, but would benefit by you taking them on. I hate to just have the last word. So if Mary Ann, might you want to say anything else in closing?